Hello, my name is SammyJo Wilkinson. I'm going to talk to you about the patient perspective on cellular therapies. Today I will tell you about my positive personal experience with stem cell therapy for multiple sclerosis and what the patient community wants to see happen with cellular medicine to highlight the plight of both acute and chronic patients that could be helped by cellular therapy. We should not have to pursue this as medical tourists. My experience, I've had MS since 1995 when I was 30 years old and just starting a .com business in the financial publishing area. This disease has no known cause, no cure, and the approved disease-modifying drugs only offer to slow the disease progression, but with a heavy side effect profile. I tried these approved drugs. They all failed me. 11, I'm in a wheelchair, suffering from over 28 symptoms, and I'm looking at nursing homes because I'm becoming so paralyzed. I've always followed cell research because I kept hearing from MS patients who found relief at foreign clinics. Then I heard about Celtex Therapeutics in Houston, Texas. They used one's own adipose-derived stem cells. When a dose is needed, only pure mesenchymal stem cells are expanded in the lab to a therapeutic dose, similar to the higher dosing I was seeing the university clinical trials using. In May of 2012, I spent 3 weeks in Houston receiving a weekly IV of 200 million of my own mesenchymal stem cells. My response was very positive, very immediately. Feeling returned to my hands. I could feel my fingerprints again. My heat tolerance was regained, my energy levels soared, the stiffness abated, so my husband and I were able to enjoy touring for the first time in many years and scheduled the next treatment for October 2012. Then disaster struck. The FDA blocked access to using one's own stem cells in September 2012. This delayed my therapy plan. But Celtex found a top-notch certified hospital in Cancun, Mexico. Under regulations established by both the FDA and COFEPRIS, the Mexican equivalent, they were able to export and import cells. I was able to resume treatment, but the extra costs and health risks associated with a 14-hour day of international travel is an extra burden patients should not have to bear. And all of this just for a 1-hour IV that I should be able to get at my local doctor's office. Without the tireless support of my husband of 33 years, I would not have been able to access this therapy. Now, after my 4th treatment in May of 2014, I can only describe my state as long-term remission from secondary progressive MS. I don't know how long this will last for, but I'm very happy with it. And my health is improving, and so is my function. I can sit outside every day in 80-degree sunshine, and the heat doesn't bother me. I don't feel sick and miserable anymore. I have enough energy to exercise every day. The time for change is now. Proposals already exist from leaders in this field on how to accelerate the approval process. Professor Arnold Kaplan, who first discovered mesenchymal stem cells in 1991 and is a distinguished presenter at this conference, has published a detailed roadmap entitled Progressive Approval. Japan has already implemented such mechanisms in the Regenerative Medicine Act of 2014. It's time for the U.S. to move forward with cellular therapies. Faster access to cellular therapy, especially for no-option patients, needs to be a national priority. The regulators need to work with us, not against us. Patients, caregivers, doctors, researchers, regulators, we all have a role to play in making this happen. Thank you so much.